There are many challenges when it comes to accessing treatment in low and middle income countries compared to high resource settings. Obviously, to start off with, for many patients, the treatment is simply not available. Therapies are not registered, they're not licensed in those countries, they're not being distributed. So many times over, these days patients have to revert into buying copycats or going abroad for treatment. However, equally important is the diagnostics. And in many low middle income countries, flow cytometry, for example, is not available. Or it might be too expensive for patients to afford flow cytometry. So the interpretation of blood films relies on fully trained hematologists. And again, many times hematologists are very scarce in low middle income countries. For example, in Tanzania, there's 46 hematologists for a population of 66 million. So you can imagine that the diagnosis of CLL is a lottery. So those are just two of the main challenges. There are also challenges relating to the perception of cancer. Patients, when they hear the word cancer or leukemia, they will no longer attend clinics because they think it's a hopeless situation, and they will go and see traditional healers. That's becoming less and less frequent, though, especially in urban settings. Patients are desperate to access treatment.